Hi, my name is Mark Staniford, and I'm CEO of Cardiovate. Cardiovate is a United States company that was founded in Texas as a C corporation. We license our technology from both the University of Texas Health Science Center for their clinical knowledge and from the University of Texas at San Antonio for their polymer science knowledge. Our mission overall is to develop and commercialize a unique patented technology for cardiovascular and other tissue applications. The picture on the right shows our product, which has been used in several preclinical studies. Some of the interesting notes about the product which make it unique is that it's made from a bioabsorbing polymer, so it actually resorbs in the body once it's done working as a scaffold. It has off-the-shelf convenience, it improves patency, and also reduces the cost of treatment. The problem is that 60% of grafts fail within 3 years. The overall clinical issue is that 1 in 20 Americans over the age of 50 has peripheral artery disease. It's a condition that raises the risk for both heart attack and stroke, which are leading causes of death. Peripheral artery disease is a progressive disease that automatically progresses, especially in the arms and in the legs and the extremities. And once it becomes very difficult to treat, a surgery is often required to restore blood flow. Sometimes you may have heard about stents or angioplasty, but those are generally temporary fixes and do not uncover or resolve the core root problem of the disease. The standard of care for bypass grafts, there's 2 types. The preferred method is to use autologous graft, which is to harvest a venous area or a vein structure from somewhere else in the body and use that to implant around the blocked arterial tissue. The problem is that half the people, 50% to 60%, do not qualify for that procedure because their vascular system is not good enough to even supply their own vascular grafts. In that case, surgeons will turn to a synthetic graft or a man-made graft, which is easy to use. It's off the shelf, sutures in place very well, but unfortunately, it has a very short lifetime. Because it is foreign to the body, eventually it will clot and clog and restrict blood flow and fail within about 3 to 4 years. So overall, our target customer really is the vascular surgeon. They're the ones that are focusing on bypass grafts. They're also the ones that are focusing on limb salvage and amputation. And this is especially critical in the lower leg area. And we talked about stenting and angioplasty. Those tend to work well in larger vessels, but in the smaller vessels, in the lower legs, which are very, very susceptible to peripheral artery disease, those are not good solutions, and bypass grafting or amputation is really the only solution. Overall, our solution is to provide the convenience of the synthetic product, but provide the long-term outcome, clinical outcome of the autologous product. And as you can see from the picture on the right-hand part of this slide, we have a very unique product because we're not only a bypass graft, but we're the only one that is also a tissue scaffold. So what we found was the interior part of the blood vessel contains endothelial tissue, which is very, very important to long-term patency. And where the other grafts fail is that they don't regenerate endothelial tissue. We found that those cells predominantly like an environment that has a certain fiber size and a certain orientation, a curvilinear orientation of those fibers in a certain density. Once we were able to narrow that down, we found out that the cells would actually attach well, they would proliferate and develop tissue on the inside of the vessel. On the outside, smooth muscle cell development is very important to regenerating a new vessel. We found out that those cells primarily like linear fibers of a certain size in a certain density, and we were able to duplicate that to get the smooth muscle cells to attach on the outside, proliferate, and regenerate tissue. So now we're regenerating a brand new blood vessel from the inside out and the outside in. And again, we are bioabsorbable, so once the vessel is developed, then we leave the body through the normal metabolic process. We do have some issued both US and foreign patents on our technology. We have been in a couple of early animal studies with some excellent results from those. These slides are showing a comparative study between our NeoVessel product, which is the name. As you can see on the top 2 slides, we show the vessel itself. Then on the right of that, we show that a CD31 stain of the cross-section of the vessel, in fact, shows the very dark area by the word lumen. that indicates full confluent endothelial cell development. In comparison, in a product that's on the market now, which is the Atrium iCast, you can see a picture of it, and to the right of that is a cross-section slide indicating that there is no endothelial tissue development. A second animal study gave us the same results where we put the NeoVessel into another porcine model for a 30-day study, but in the carotid artery. And we found the same results as you can see in the lower left-hand slide, where we have the arrows where we're creating new endothelial tissue development. So we know that it works initially, but we still have development work to do. The next slide is showing competition. In the upper left-hand side are all the existing grafts that are on the market from Bard, Mackay, Gore, Atrium, etc. Again, these are easy to use, but they don't last very long. They're not a good clinical solution. They don't provide long-term patency. In the lower right-hand side, we have some newer technologies that are coming to market, but they're very complex, they're difficult to use, and they're extremely expensive. And the doctors that I've talked to, or the surgeons, felt like they weren't a good solution that they would provide to their patients. In the upper right-hand corner, we show our CardioVate product because we're both easy to use and we provide excellent long-term patency. If you look at the market that we're focused on, it's the peripheral graft market, which is over a $7 billion market, the US market this year. And if you look at it, we are participating specifically in the synthetic graft side, which is a $511 million market. But if you look at it, by the time we get our product fully developed into market, we feel like this is going to be about a $748 million opportunity that we're going to be targeting. The nice thing, as I mentioned in the beginning, was that this is not just a vascular platform, but this is a different type of technology that can be tuned to different tissue types. So we could focus on gastric repair, hernia repair, wound healing, so on and so forth. The balloons indicate this number of procedures available. So we have a tremendous amount of opportunity. And since we're not using any drugs or human cells, it's purely a mechanical action. We can just change the fiber diameter, the density, and the orientation, and we'll be able to get cell proliferation and tissue development. Overall, we've got a very strong team focused on this, all the way from our chairman down through our advisors, and we're all led by myself, Mark Standiford, who I have over 30 years experience in the development and commercialization of medical devices, which have led to over $7 billion in incremental revenue. So I thank you for your time, and you've got a good overview of our technology. Please contact me further with any questions. I'd like to hear from you.